Well, good afternoon, everyone. My name is Tanya Abreu, and I am the president of Spirit Health Networks and also our chief visionary officer. So I get to do the fun stuff, which is kind of talk about, mile-high strategies and the current temperament in the area that we work in, which is women's health and women's health marketing. I am joined by my executive vice president of strategic development for our hospitals, Guy McClurkin, and we want to spend a few moments of your time, and I know how valuable it is, really discussing the new power of marketing in the era of healthcare reform. And of course, we put some buzzwords up on the title slide, and we're hoping they mean a lot of really positive things to you by the time we're done this afternoon: mobilization, navigation, and population coordination. I also want to give a special thank you to our member hospitals that are joining us today, as well as hospitals who don't know very much about our networks of hospitals, but really want to learn about the current environment and how it's changing. So thanks, everyone, for being here. So let's just get started, and if you have any issues in hearing this or any problems, please go ahead and send us a note so that we can adapt and respond to you. We here at Spirit have experienced with our clients a lot of pushback and resistance when we use the word reform. Reform seems like a negative. It seems a little bit oppressive. When we talk about political reform or we talk about economic reforms, it always means a whole lot more discipline and a whole lot more tightening of the belts and getting to a new way of doing things. And so we like to think, if we respect the power of words, to substitute the word transform, and to really begin to think about healthcare reform as healthcare systems transformation. And we'd like to share a couple of the aha moments that we have synthesized over the past, I'd say, 18 months of working in the C-suites of hospitals across the United States. Guy, who I introduced prior, who's very, very much our numbers man, our business analytic man, who works very closely with the CFO and the strategic development executives of hospitals to really explore opportunity. He will be talking a little bit about the opportunities inherent in accountable care and certainly in the Affordable Care Act. We'll talk about transforming instead of reforming your marketing communications and your definition of what it is. We will talk about a cardiovascular service line example that really does offer a case study in opportunity under healthcare reform/transformation, and then we'll end with some opportunities to collaborate. As I said, change really does depend on your perspective. There are two dictionary definitions that I'd like to share with you. The first is reform, which is to put or change into an improved form or condition. And just the word improved really infers that what you have is not good enough. And right there and then is a little bit oppressive, and I think a little bit negative. And you don't get real excited when someone tells you to reform yourself. However, when someone tells you to transform yourself, there's a whole lot more positive energy. It is to change totally the composition or the structure of something, including yourself. And I think all of us personally would rather go through personal transformation than personal reform. I challenge you to think about the healthcare industry right now, today, in its volatile state, as needing to undergo transformation. And a question that I always encourage us to consider is, what percentage of your professional time, maybe even personal, do you spend trying to keep things today exactly like they were yesterday? And here at Spirit, we say that is time wasted. So let's go and think a little bit about the ahas of healthcare transformation. And the ahas, like Oprah would say, are the positive moments of future progress. The first one that I don't think we can repeat enough, and if you repeat this enough in your C-suite, I think you'll gain a little bit of respect. They'll hate you for it because it's the hardest one to deal with. and that is somehow operational efficiency will be more important than controlling costs. I spent the first 15 years of my healthcare experience in a hospital, and when we had an imbalanced budget, the only thing we were told to do was to cut costs. There really wasn't a strategic analysis of how the revenues were coming in or how the expenses were going out. It really was just about cutting costs. Reimbursements were everything. That was how we made money. That is how we were in the black. In today's environment, reimbursements are not revenue, and operational efficiency counts more than cost control. The other aha is the competency of your clinical care providers will be questioned, measured, and rated, perhaps for the first time ever. We are not talking about CEUs. We are not talking about doctors just going to learn by video and perhaps some brief little hands-on how to use a new surgical robot. We are talking about taking physicians, not fellows, but physicians who may have been in practice for decades, and measuring their competency. So as a hospital, so as a healthcare delivery system, we reduce our risk for medical errors, and we increase our risk for positive patient outcomes. Measuring competency also helps us increase our operational efficiency and therefore keep ourselves profitable. The third aha I'd like to share briefly. It is hard to do this in a webinar. I just would love the interaction with you, but your hospital's quality, success, mistakes, and productivity will be transparent to your competitors and the general public. We've been getting used to this whole transparency issue since like health grades, and a lot of those things have really come down the pike in the past 5 years. But the one thing I'm always amazed at, especially when I work with marketing executives, is they don't get the fact that your competition is going to have that too, just like you'll have theirs. It's going to be a transparent world of pitched up against each other, neck and neck, cost and cost, physician and physician, outcome to outcome. How are you going to differentiate yourself in that? How are you going to control and influence that transparency? Here's a good one, and it's one that doctors are, their jaws drop when they really think about it. Patients will expect you to talk to them in person, on the phone, and online for the very first time. And I know that informatics all across the country are struggling to find ways to do this with HIPAA constraints, but also to get paid for it. Patients are expecting navigation, and they're not expecting just to talk to a hospital operator. They're expecting far more dialogue. And in the new world of healthcare transformation, patient satisfaction increases in importance as we begin to think about government, federal subsidies, et cetera. So to get to that satisfaction, we have to start adding more interaction. That's my new golden rule. Patient satisfaction is patient interaction. And lastly, marketing as we know it will become slightly different, maybe radically different in terminology, but I think some of the functions are the same. Mobilization of populations in our community, the education of those people, the navigation of individuals within that population, and the coordination of our results. So those are my 5 ahas, and we will make sure that you get a copy of this if you'd like to pick them to pieces and share your experiences with them post this webinar. Now I'm going to turn this over to my left brain, Guy McClurkin, to talk about the silver lining in this storm cloud of healthcare reform.
Thanks, Tanya. You know, a lot of us, especially with the elections and the Supreme Court decisions and all the hoopla about accountable care, the Affordable Care Act, and all the different pieces of the accountable care, there have been so many questions and so many delays and so many different ways that people have thought about accountable care that we're all sort of just in a mess about it. But now it's time to really look at the opportunities, and we tend to take an optimistic view with Spirit Health Group and all of our 100+ hospitals across the country, and we really look at the silver linings. There really are several. In addition to sort of being the right thing to do to provide greater access to health care in the United States, there are some things that hospitals and providers will directly benefit from, and we're always looking for those opportunities to provide our hospitals with the biggest and best steps forward in terms of competitive advantage. So First of all, millions of newly insured patients seeking your services. Some people look at that with trepidation because they don't know how they're going to treat these people, or they don't know what the insurance rates were going to be. But we tend to think that some money for patient care is better than no money for patient care. So greater volumes in the door with paying means is a better thing. Reimbursement will and is driving hospital-physician alignment, which is a good thing. More and more, as we're on the road talking to hospitals, we see greater alignment, greater affinity between individual hospitals and individual physicians in the market, and that's a good thing. It's better patient care and better, ultimately, management of populations. Planned and prescribed preventive health and wellness with reimbursement, which is a tremendous value and something, frankly, that the American healthcare system has never provided. Reimbursement for wellness, not just reimbursement for treating the ill and injured. Pretty novel idea, actually, and really provides hospitals with great new avenues that I'll walk through in just a second. But really, again, and this backs up Tanya's statements as well, the incentives are beginning to align. And whether or not your political persuasions lead you to enjoy this kind of thing, the incentives for better management of care and more appropriate care are always better for our consumers in the local market. So more coordination of care and navigation throughout the system, more communication before, during, and after a particular episode of care leads to better population health. So at Spirit of Women, HeartCaring and Spirit Health Group, we've sort of booked our business over the past 15-plus years on the facts that are before you right now. Women can be, in accountable care, your not-so-secret weapon. Women are the single largest and most influential demographic in every healthcare community, including all of yours. And we have built our business around communicating and promoting service lines and hospital services and physician services to women in every single market, not just the traditional definitions of women's health, such as OB, breast care, and osteoporosis and menopause, but rather promoting all of a hospital's services to women as the key healthcare decision maker and the key healthcare consumer. And there are lots of statistics on the screen there in front of you. I've seen many more that would suggest that more than 85%, in some cases 90, 92% of all healthcare decisions in the United States are made by women. Tremendous amounts of dollars and decision-making are controlled by women. There's a tremendous amount of value, financial value, to be attained by a hospital who's able to retain a woman and her loyal family for downstream encounters and revenues. Women account for massive amounts of healthcare spending and will continue to in the past. We've done a lot of research and always keep our research fresh. But just to highlight the fact that this is not a flash in the pan, by next year, by 2013, over 21 million more women will turn 50, and many more, 64% of the female population will be in non-reproductive years. So we do need to focus on the traditional definitions of women's health, but we need to be able to reach out and really provide that continuum of care. Accountable care really has opened the doors to a few things and slammed them shut on others. But when we think about how hospitals access patient populations, it's really from the three things in front of you: insurance providers, patient choice, and physician relationships. And we, providers and people who work in hospitals, have the ability to directly impact 2 out of 3. There are a few people in your C-suites who are negotiating your insurance contracts, and we can't control that. But what we can control are the direct interactions and the quality of those interactions between patients and physicians and us. And in the world of accountable care, and highlighting several of the points that Tanya made in the AHAs, patient choice and patient satisfaction are as important as physician directives. So it's ultimately important that we communicate effectively, consistently, and constantly with both of our main constituencies, patients and physicians. So let's think about healthcare marketing today and directly in the past. And it's a pretty simple model. It's a scattershot approach to communicate everything to everybody. Think about a health fair. We are promoting all of our services to all of the people all of the time. And we're able then to screen the asymptomatic population. And a lot of the services, or really the the outlines of the accountable care models in affordable care rely on screening appropriately, only screening those people who need to be screened, treating the people for the entire continuum of care, but not thinking only about their episodes in your hospital or in a physician offices, thinking more holistically. And I know it sounds idealistic, and it is, but it really forces all of us to think in a different way because the reimbursements are going to follow this model. So we get to the title finally, the new power of healthcare marketing. What is it? Well, how can we benefit? And it really has to do with population coordination, encouraging healthy behaviors, building and retaining populations within your healthcare system, whether that's through an ACO or some other model, reducing readmissions through effective communications and navigation, and improving patient, and I would add family satisfaction. Right now there are holdbacks and direct financial impacts to hospitals based on patient scoring, patient satisfaction, based on reducing specific readmissions related to chronic conditions, and all of the things there. So marketing is not just fluff. It's not just talking to populations and having the best billboard in town. It really has directly to do with the revenue cycle of every hospital in the country. And in the past, we have not necessarily put the patient or the consumer in the center of this whole continuum. So stick with me a minute here, and I'm going to show you exactly how the right way to screen, and right in quotation marks, the right way to treat patients and communicate with them to really continually benefit them in the future, and definitely to build your hospital's business. So first, by focusing on the patient, we want to encourage the healthy behaviors, but first identify and stratify risk. That can be done many different ways. We'll get into that in just a second. But after you identify and stratify that risk, then you screen. You don't screen all of the asymptomatic populations. Screen those who need to be screened for specific conditions. Beyond that, after the screening results are back, we're able to then refer and prescribe within our system. This is where the true navigation begins, with interaction with your patients and your physicians as well. As you might expect, once you prefer and prescribe, you treat, manage, and navigate that patient through whatever needs they may have for illness or injury or some family condition that they may have. And then we follow up. It's not just sending them to the rehab hospital or to the rehab unit. Really, there needs to be a communication loop in every single one of these steps. And by focusing on this, you have the ability to really impact directly the revenues and the successes of your hospital. As in the last slide, there's a very one-way communication. We communicate with consumers to tell them what we think they need to know, and then we ask them to make the decision and hope for the best. In the new way of thinking about marketing, communicating, and managing the expectations of populations, it's really a constant two-way conversation. When we're talking about identifying and stratifying risk, we do the traditional competitive marketing, highlighting our services, the access, our physicians, highlighting the things that people should know about our systems. But then we're also in the business of directly recruiting patients, and that can be done a lot of different ways. Remember, the first step is to identify what risk factors these individuals might have in your communities, and that can be done by promoting specific wellness visits that are new components of the Affordable Care Act, and also through online health risk assessments. Lots of different tools at your fingertips to have those conversations. And then once, again, the risk has been identified, then, again, sort of following up with those same populations appropriately to provide them better points of access, to show them where the entry points are for treating their risk if they seem to have a symptom of the risk, or really to prevent an illness or injury. Again, providing your capability statements and introducing call centers. So if someone has a particular risk factor and they need some help, being that resource, being the healthcare Google in their market, and providing some direct doorways or paths into your healthcare system. And always condition-specific clinical education, simply written, easy to digest, in a fun and different way that they're used to seeing it. So it's not so scary, but it assists them in managing their own risk factors. And then in the event of a positive or a screen that requires additional follow-up, we need to make it easier. We need to make it easy for the patient to access physician and provider profiles. As Tanya mentioned, the transparency of our providers is going to be greater and greater, and we need to go ahead and step up and provide the people with the information they want to make the decisions. Physician service line or service line directories and capabilities, the ability to easily and effectively schedule appointments, and official navigation throughout your healthcare system. In the fourth section there, pre-admission education. Think about how many times we can shorten length of stay by having people prepared when they come to your hospital. Think about different ways that people should be educated before they walk in the door to manage their anxiety about being an inpatient or being even in an outpatient situation. And then, of course, discharge planning to reduce readmissions. There is a tremendous amount of education and communication and information that needs to be, a lot of Q&A that needs to occur with patients while they're in your system of care to make sure that the outcomes are better. Because ultimately, we're all about making sure that women and their families are treated better in your healthcare system. And finally, clinical follow-up, patient satisfaction, ongoing wellness education, checklist to keep them well and sort of out of your hospital, and always more question and answer time. And then we sort of start the beginning of the loop, start at the top of the loop again, and begin with wellness screening and making sure that throughout their lifetimes they're taken care of. So with that said, in a world of universal access, meaningful use, and accountable care, marketing becomes mobilization and measurement for population health coordination. Again, to reiterate, when we are talking about inserting marketing communication in the center of the world with our consumer and physician interactions, it has a direct impact on your hospital's financial status. So transforming your marketing communications from a one-way conversation to a patient to a central part of your ability to drive and attract greater populations to your health system and to keep them loyal with you, direct impacts. Increased patient and, again, family satisfaction leads to direct revenue. There are holdbacks now that hospitals experience, as you probably well know, based on patient satisfaction scoring. Physicians will soon be in the same boat. There will now be holdbacks and even penalties for high readmission rates. And so communicating with patients to keep them out of the 30-day readmission cycle will equal direct revenue to your organization. Innovation and edge equals new and desirable populations. We're all going to have a lot of newly insured people, but we need to influence early and often the women in our markets particularly in a way and by a means of communicating with them in a way that they haven't been with hospitals in the past. They don't want to be scared into going into a physician office. They want to be communicated with on quality of life issues, on issues that are important to them and taking care of their families. And there is a cost savings measure here as well. Consolidation and integration of messaging to your populations makes a tremendous amount of sense. If you can launch a single platform and communicate effectively with the most influential groups in your organization, you're going to save costs of reintroducing or recreating the wheel every time. And then also, more consistent messaging provides you with greater benefits. Again, promoting healthy behavior and equals engaged populations, which means loyal consumers, and the ability to keep your patient base strong and loyal is ultimately important to your financial profitability. And of course, strategic marketing, thinking about all the things we've talked about today as an ability to create competitive advantage and profitability in your market. These are the things that we are focusing on at Spirit Health Group as we work with our hospitals across the country to really benefit each individual hospital community with the altruistic goal, of course, of creating better health, better wellness for women and their families, but ultimately focusing on the bottom line of the hospitals. So I'll hand it back to Tanya now.
Yeah, you know, every time I look at that model that you've developed, Guy, to help bridge sometimes gap between marketing executives and financial planning executives. And I just, if nothing else, for those attending this webinar, to think about those bubbles as ways to really look at your 2013 marketing plan and how you are aligning with physician goals and strategic service line goals in your hospital for greatest impact. Full disclosure, HeartCaring is a product that Spirit Health Group sells to hospitals in order to grow cardiovascular and early intervention revenues very rapidly and very successfully for the past 6 years. We do that by focus. We work with the NIH. We have a gender-sensitive designation that we give to hospitals, and it's a very exciting program. But it was born and developed prior to the maelstrom of healthcare reform, and we really are very proud of it because it does something very simple. And I put it up here because it's been working. And if you want to talk about the model, because it's very, very simple, if you want to talk about it, go ahead at the end of this, our name and our emails flash up. Please give us a call. But it's very simple. We have worked with hospitals to mobilize new at-risk patients, patients that are women in their 50s, patients who are in their primary care physician office, or even better, in their OBGYN offices, because we know that women post-reproduction and pre-imminent death tend not to go to the doctors, except for their gynae relationship. So we developed with our hospitals a program that goes into those practices and finds the at-risk patients that need to be screened and navigate them to the host hospital. It is very, it's not rocket science, but the infrastructure that we've developed over the past 7 years really works quickly. And the designation, kind of the government saying, hey, these hospitals and these doctors, although they might be gynecologists, are also heart diagnostic experts for women. So once they're mobilized, they come to your hospital, and it is the hospital's obligation to navigate these women across the continuum of diagnostics, intervention, even surgery and rehab, so that there's excellence in individual outcomes and profitability. And my friends, that middle bubble right there is the heart of healthcare reform. Let's get a woman before she's acutely ill, before she costs us too much money, find her at the right place at the right time, navigate her to the right space in our healthcare delivery system, and follow her through. The last bubble that HeartCaring does address is manage the population and statistical outcomes for improved population health. We encourage and partner with our hospitals to say, okay, what were your numbers of women screened at risk prior to HeartCaring? They're always considerably lower than the 52% of women who die from heart disease, that's for sure. So then we take a look, we look at the public health demographics, we go to the CDC, and we are able to help hospitals demonstrate, not just in their community reports, but to their board and to their CFO, the value, both from a community and philanthropic perspective, but also a very real business perspective. So that's our HeartCaring example. And I'm going to end this because there are opportunities to collaborate. We're not traditional consultants by any stretch of the imagination, but we do what I would call kind of, flashes of something that most hospitals are familiar with as consulting experiences. Our networks have thrived in the past on doing workshops with leadership in your facility to really build consensus. That's all it's about. That's all consulting is about. Consultants have no true knowledge. I'm sorry if someone's on the phone. What we do is we listen, we synthesize, and we feedback. Maybe something you already knew, but you weren't quite sure how to articulate it loudly to get it done. Well, here's the 4-hour intensive on-site workshop that we do, which is called Reform Readiness, Building Competitive Advantage Through Mobilization, Navigation, and Management of Targeted Populations. And in that workshop, we have proprietary exercises, very interactive, to work with your leadership to kind of figure out where you need to be quickly quickly, because I will tell you, and so does the American Hospital Association, is you ain't got 5 years to make sure that you're the leader in your community. You have more in terms of 12 months, in some cases, in some competitive landscapes, less. We are happy to do that workshop. The cost of that, and I know most of you are used to very large consulting bills. We're learning, and we like to learn, and we're charging $5,000 for 2 of us as executives to come out and run this workshop and to deliver a report of recommendations. Now, not an operational report, not a service line plan, not even a comprehensive marketing, but really a synthesis and focused list of recommendations gleaned from that 4 hours. We have 2 other opportunities to collaborate. HeartCaring, which I mentioned, which is a very quick feed of financial gain and appropriate utilization of your diagnostic services and your cardiovascular service line. And then we have lots of members on the phone today, know us as Spirit of Women, and that is a comprehensive, very laser-focused approach to targeting service lines that need to be developed through women's choice of a healthcare provider. Really comprehensive tactics and clues, strategies. Both of those we can talk to you about. We can talk to you about on the phone. We can put you in touch with our clients. We can also do that workshop I mentioned and then have lunch and then really just spend an hour talking about HeartCaring and Spirit of Women. If we do that and you decide to join within a few weeks of our on-site, we credit that $5,000 to your membership. And currently, membership in Spirit of Women is $69,000, and membership in HeartCaring is 36, I believe, 35 or 36. That includes a whole lot of stuff besides consulting and materials and planning. It is travel and conference, but it's comprehensive. I want to end by something that seems, trite, but I'm telling you it's how we've stayed and grown in business significantly while we've seen a lot of people working in this area of women's health disappear. Your success is our priority, regardless of the environment. Right now, I do feel blessed and extremely grateful that we have never been as busy as a group of executives working for the U.S. healthcare industry. We'd love to just hear from you. If nothing else, send us an email, call either one of us. We're happy to be of service, and most importantly, we're happy to learn from you.
So we'll open up the line for questions. Feel free to use the chat function if you'd like to type in a question. Or if you'd like to unmute your phone and answer or ask a question, we're happy to stay on the line for a bit and answer the question.